According to the CDC, 8% of all Americans are affected by the flu, and thousands die because of flu-related illnesses. Here to talk about flu vaccines is Dr. Mravcak, Medical Director in Jersey City, Vanguard Medical Group. Dr. Mravcak, thank you so much for being here.
Hi, Anvi, my pleasure.
And so flu season is upon us. When is the right time to get the flu, and who needs it?
So the right time to get the flu shot is now. You want to get the flu shot in before flu hits. So flu season is generally October through May. So we want to get everybody vaccinated before the end of October. So now would be a perfect time to go. And who needs the flu shot? You do, I do, everybody needs the flu shot. So all adults, all children over 6 months old.
And are there any specific high-risk groups that we should be focusing on?
The majority of people who get the flu don't end up in the hospital, but there are some groups who are more likely to end up in the hospital and even die from flu. And those are going to be children less than 5, adults 65 and older, people with chronic medical problems, so heart problems, asthma, kidney problems, diabetes, and pregnant women.
And a lot of people don't take flu seriously, right? But flu is the actual disease where people are dying from it. So what are some of the complications that flu can lead to?
Yeah, flu. Now, again, most people who catch the flu who are healthy adults don't have serious complications. Don't get me wrong, you will be sick, missing out on work and school and everything for about a week with the flu. Complications from the flu, you can end up in the hospital, you can have a pneumonia, you could have sinus infection. Some people do die from the flu. If you've got a chronic medical problem like diabetes or heart issues, it could make those problems worse.
And there's a lot of confusion between the flu and the common cold,
yeah,
right? So when the symptoms are very similar,
yes.
So how do you differentiate between the two?
Anvi, that's a great question. So I have a lot of people who come in and say, I have the flu when they really have a common cold. Two big differences, the onset and the severity. So the common cold has a gradual onset. You get a runny nose, maybe a sore throat. In a couple days you get a cough, you don't feel well. With the flu, it hits you like a truck. People can usually tell me when they got sick with the flu. And it's very severe. You usually have a fever, very bad body aches, very bad fatigue, often a cough, maybe a sore throat, maybe a runny nose, sometimes diarrhea, and sometimes vomiting.
There are different flu vaccines for different age groups, correct?
Right.
What
Right.
are they?
So at Vanguard Medical Group, we offer a standard flu shot with a standard dose. We've got a high-dose flu shot, and that's indicated for people who are 65 and older. And then there's a recombinant vaccine, which is indicated for people who have egg allergy.
How effective are they?
That's a good question, too. And the effectiveness varies year by year. The reason for that is because the flu virus is very smart and it mutates. So we have to stay on our toes and design a flu shot each year that's going to cover the flu that's circulating in the environment. So I can't tell you this year how effective the flu shot's going to be. We'll have to wait and see.
So last year's flu vaccine was only 30% effective.
Yeah.
So what would you say to somebody that says, why should I get the flu vaccine when I still got sick?
Generally, what I've seen is people who received a flu vaccine and still got sick, they had a milder flu. So they weren't sick as long, it wasn't as severe, they didn't end up in the hospital, they didn't die from it. You're still getting some protection, even though you still got the flu.
Regardless of the efficacy of the flu vaccine, everybody should get the flu shot.
Absolutely.
Okay. And when you look at other vaccines, like measles vaccines or shingles vaccine, they're very effective. Why can't we get there with the flu vaccines?
That's a really good question. The flu virus is very smart, and it keeps changing. So it's very difficult to make one vaccine that's going to cover all the flus that are out there each year.
When somebody does get the flu vaccine, right, what are some of the side effects that they can experience?
Okay, so most people have no side effects from the flu vaccine. The most common side effect is going to be some redness, swelling, or pain in the area where the shot was given. There are some people who have a reaction to the flu shot where maybe they get a fever or they feel achy. If that happens, it will usually occur soon after the shot was given and won't last more than 2 days.
And if you have the cold or if you have the flu, what is the time frame? Or should you even get the flu vaccine?
If you have a mild cold, you can still get the flu vaccine. If you've got a more severe illness, like with a fever, cough, pneumonia, you should wait until you recover.
In your practice, what do you advise your patients on preventing the flu?
The best way to prevent the flu is to have the flu shot. But other than that, you want to stay away from people who are sick. If you have somebody at home who's coughing or sneezing, make sure they're covering, make sure they cough or sneeze into a tissue. Don't share food and drinks with people. Try not to touch your face. So you can get the flu by touching a door handle that has flu virus on it and then touching your eye.
Let's talk about the flu in itself, right?
Yeah.
It's a viral infection,
right.
not a bacterial infection.
Right, right.
Because a lot of people, there's this misconception where if I take a Zithromax or Z-Pak,
yeah.
I can resolve my flu.
Right.
So how do you advise on that?
Okay, so difference between viruses and bacteria. Viruses will not be killed by an antibacterial or an antibiotic. Bacteria will be killed by an antibacterial or antibiotic. What we use for flu is an antiviral medication that needs to be started within 48 hours of getting sick.
And so you mentioned 48 hours.
Yes.
So what are some danger signs of the flu that should alert someone that, hey, I need to go to the doctor so I can get the treatment in time?
Right. If you have a fever, severe body aches, severe fatigue with a cough, you might have the flu. And in that case, I wouldn't rush to your doctor's office. I would call them. Because it's not a great idea for somebody to sit in the waiting room while they have the flu, potentially exposing other people.
How infectious is the flu vaccine once you start the treatment?
The influenza virus can be spread between people one day before somebody starts feeling sick and up until a week afterwards. Generally, when somebody has not had a fever for 24 hours or more without taking medications, they're no longer infectious and can return to work and return to school.
And what are some of the side effects of these antivirals? You mentioned earlier about a new drug that's out on the market for flu.
Right. So there are a couple medications out there for flu. All of them need to be started within 48 hours to be maximally effective. They're tolerated very well.
We mentioned flu vaccines, so the high-risk groups, so the elderly, they also have tons of other vaccinations that they need to get. Pneumonia vaccine, shingles vaccine.
Sure.
How safe is it to give the flu vaccine with the other two vaccines?
Completely fine.
Okay.
Completely fine.
And so they can take them at the same time.
Absolutely.
Without
you can
any
get the
side
flu
effects.
shot with the pneumonia shot. You can get the flu shot with the shingles shot.
And let's talk about kids and the flu vaccines. Is there a particular dose? Is it the same dose as the adults that the kids get?
Right. So it depends on the vaccine that's being given. If the child is less than 3 years old, it's usually a half dose. There's one vaccine that came out this year where it's a full dose for them. So I would, refer to the prescribing information in the vaccine and talk to your doctor.
A lot of kids, do they see more side effects from the vaccine since their immune system is not fully developed versus the adults?
No, not that I've noticed.
Thank you for your thoughts.
Sure, my pleasure.
Dr. Mravcak, Medical Director in Jersey City, Vanguard Medical Group. Hometown, we'll be right back.